Hello everyone. Today I'm going to be talking about ganglion cyst, focusing on the hip, which is a very uncommon place to find the ganglion cyst, and what other symptoms can be associated with this type of issues. And most of the ganglion cysts are asymptomatic, and usually this is happening around the wrist, on the dorsal side or the ventral side, and it can also happen in any joints basically. It can happen in the shoulder and in the hip and in the knee, and uh, and those ganglion cysts, as they are asymptomatic most of the time, but it can also cause pain in some cases, and if it is close to the other tissue that is pushing it, especially the nerves. The best way to see and diagnose the ganglion cyst, besides appearance and the range of motion might be restricted, it is the MRI. An MRI would show the ganglion cyst very clearly. And if somebody has that, most of the time they leave it alone, but if it is causing pain and other issues, it needs some type of conservative treatments. And the physical therapy would be one of the things: range of motion, passive and active movements, strengthening the muscle, and ultrasound, acupuncture. All of those are the type of treatments that the ganglion cyst can receive and get it treated for. And but if none of those are happening, in the worst case, surgical procedure is the type of the treatment that the surgeon is offering. And here is an example of ganglioside that can happen in different regions around the hip. And this is a normal anatomy of the hip joint, and it is viewing from the back. And this is one is showing the hip joint and viewing from the front. As you notice that we have the ganglion cyst that can happen within the sheath of the nerve or outside the nerve around the joint and the capsule. And any of those ganglion cysts can cause the compression on the nerve and the tissue around, which could cause the some type of pain. And it is also showing right here, and that is around the pelvis area, and this is the front of the hip capsule, and this also shows that other possibility of the location of the ganglion cyst. But here is the issue. The issue is that when the ganglion cyst is pushing the nerve, it is going to cause the neuropathy, that's for sure. But most of the time, the doctors are going to be looking at the spine area, and or the other areas that is not close to the ganglion cyst where it is located. And for that reason, either diagnosis is not correct or the location of the issue is not detected correctly. And for that reason, the treatment is going to be very limited. Even they try their best to get it done. And sometimes, unfortunately, people might get into the surgery of the spine or other locations which has nothing to do with the ganglion cyst, and this ganglion cyst is going to be persisting. It's a problem in the patient. So it is very important to include the possibility of the ganglion cyst in different regions of the body, and not to make a problem or the mistake that it is the spine issue that surgeons usually, unfortunately, jumping to do the surgery and take care of the problem, which it will not take care of the problem if it is not being diagnosed correctly. And again, if you have any question about this one, you can send me a message on the YouTube, and or call contact the office directly. And but again, if you have some issue in the hip and it's going to cause the shooting pain, and the patient and the doctor says that it is the sciatica or femoral nerve neuropathy, again, making sure that the doctor is thoroughly examining you or a friend or loved ones, and the procedure is done correctly for the cause of the issue. Again, this is Dr. Marzban, and I hope that you have a wonderful day. I will talk to you soon. Bye bye.